Hey folks, welcome back. Emergency medical responder. Hey guys, this is a very important chapter. This is chapter 14, covering bleeding, shock, and soft tissue injuries. Soft tissue injuries can come in a wide variety of shapes and forms and all that kind of good stuff. They can be very horrific type of visuals. But understanding bleeding and shock is super important. And you as a first responder, how you're going to manage that is very important. Especially the recognition of when somebody's going into shock and what you should be doing until other responders arrive. All right, so with that said, let's get started. All right, so bottom line, EMRs, you folks need to be able to recognize and care for patients who are suffering from shock, bleeding, and soft tissue injuries. Good adherence to the standard precaution is important when caring for patients with soft tissue injuries. Remember, these folks are bleeding, okay? So as they're bleeding, you want to protect yourself from it. So scene safety, BSI, you got your gloves on. Always need to wear some safety goggles when people are bleeding because you don't want blood splattered up into your eyes. So you need to make sure to think about those things. Also consider that damage to internal soft tissues and organs can also cause life-threatening conditions. Internal bleeding causes the patient to lose blood in the circulatory system and ultimately will result in shock. So the blood, your pipes have been somehow affected. Remember, we talked about your pump, which is your heart, your pipes, which are your blood vessels. When the blood vessels get ruptured on the inside and there's no, from blunt trauma, the blood leaks out into the body. And so therefore you're losing blood, which ultimately will result in shock. Shock is a state of collapse of the cardiovascular system that results in inadequate delivery of blood to the organs. More trauma patients die from shock than of any other condition, folks. So if we have bleeding, especially external bleeding, we need to stop it. I mean, stop the bleed. You stop the bleed, okay? You can't stop internal bleeding, but early recognition is the key, looking at mechanism of injury, the history of the trauma itself, recognizing it early and get them promptly transported to a hospital where they can go to surgery, because that is the only fix for an internal bleed. First responders should also learn to gauge the extent and depth of the burns and understand their causes. So when you have burns, we need to know about them and how to assess what they are. All right, so once again, let's go back to the 5 components of the assessment. Again, say it with me. Scene size up, primary assessment, history taking, secondary assessment, and reassessment. Folks, you got to have this. As long as you're in emergency medicine, I can't reemphasize this enough. You got to know this. If you pre-learn this and come into our EMT program, you're going to be so far ahead of the game, it's going to be phenomenal. You'll be doing very well with it. All right, next slide. All right, so following the steps of the patient assessment sequence, always very important. I mean, this is, people that are bleeding, people that are going into shock, have tissue injuries, we still follow those assessments. Scene size up, needs to ensure the safety of both you and your patient. You may need to halt the primary assessment if the patient is losing too much blood. You're going to have to stop the bleeding somehow. During the secondary assessment, be alert for signs and symptoms of shock or any internal or external blood loss. When performing a reassessment, remember that's at the end, watch the patient for the following signs and symptoms of shock. They get real pale, a kind of pale or a grayish kind of look, and their pulse rate gets faster, okay? As you lose blood, the heart has to go faster to compensate for its loss. It's got less blood in there, so it's got to work harder. It's got to go faster to pump that little bit of blood that's left to get it to all the organs. And then finally, and this is the last signs of shock, or late signs of shock, is decreasing blood pressure. So when you're taking vital signs and in an adult, it's dropping below 90 systolically, that person's getting in trouble. When you notice that it's dropping below 90 systolically, just to kind of bring you into this, when you feel for a radial pulse, it's not there. You have to have a systolic pressure, that's that number on top, of at least 90 to be able to feel that radial pulse. Remember the radial pulse? Right here in the radius, you're going to feel right there, okay? It's right on the thumb side. That's where you check for a radial pulse. Remember that from back in patient assessment. All right, so when you lose that, you know your patient's going into shock. All right, so the concept of standard precautions, we all have talked about that. You know about it. You need to wear your gloves. You should wear appropriate face shield or a surgical mask. You know, eye protection is very, very important. Very, very important, because if the blood splatters in your eye, that's considered a significant exposure. All right, remember this? Remember this, guys? Please, please, please look this back over. This, again, tells you how the body works. It is one of the best tools, wonderful, wonderful diagram that you can see. Remember, this is how it all flows. This is how it works. Let's go over it one more time. All right, so down here, this area here, this is the inferior vena cava. This area right here, this vessel right here, is the superior vena cava. And you notice it's blue. It's blue because it's carrying unoxygenated blood that's coming from the organs and tissues. It's coming back to the heart and lungs so it can be reoxygenated. So it is unoxygenated. So it travels, remember, everything goes into and exits out of the atriums. It travels this, it comes into here. This is the right atrium. The right atrium then pushes it down to the right ventricle. The right ventricle then pushes it up into the pulmonary arteries. Pulmonary arteries, push it over into each of the lungs. As you can see, there's a bifurcation here. It pushes it over to each side of the lungs so that the gas exchange can happen. Remember, unoxygenated blood has carbon dioxide. Look at this, CO2, carbon dioxide. It has carbon dioxide in it. It is the waste product of what our cells, can't use. It's the waste product of metabolism. So it's got to get rid of it. So it goes into the lungs and is expelled when you exhale. You get rid of the CO2 when you exhale. And then you inhale again, and then oxygen comes in and it goes into the other side. Okay, as you can see here, the oxygen goes into the pulmonary veins, okay? And the pulmonary veins bring it back to the left atria. The left atria, see that sign? See that it says right there, left atria. The left atria pushes it down into the left ventricle. Left ventricle pushes it up into the aorta, and it goes out to all the different cells, the cells in the upper body, which include the brain, okay, the brain and the tongue, everything up there. And then it also pushes it the other way too, to all the cells within the lower body, your legs, your lung, your stomach, your spleen, your liver, all that stuff. This is the cycle, folks. Study this. This puts you, again, way ahead of the game when you go into EMT school, because this is how the body's circulation system works. Okay? Good stuff, and easy to follow, easy to remember. Just remember, the ventricles are the workhorse. All it does is it pushes blood around. The atriums is where unoxygenated blood comes in on the right side, and oxygenated rich blood comes back in from the lungs on the left side. Okay? Good stuff. Good stuff. All right, so we talked about this. The pump, the heart functions as a human circulatory system's pump, and it consists of those chambers. Okay, 2 upper chambers are the atrias, and the 2 lower chambers are the ventricles. There you go. Another great diagram of it. Study this. This is how all this works. Okay, this is how, remember we talked about it. Vena cava, right atrium, right there. Okay, right atrium, boop. Right there, and how it goes through the valve, okay? Goes through the valve into the right ventricle, and the right ventricle pushes it up through and into the pulmonary arteries. See, there you go, pulmonary arteries, where it's taken to the lungs, and then returns from the lungs through, here we go, I'm gonna draw a little arrow, to the pulmonary veins. Pulmonary veins dump it into the left atrium. Left atrium pumps it through the pulmonary valve. Okay, you can always remember this valve because the pulmonary valve is on the side of the pulmonary veins. It's what's coming, from the lungs. pushes it down into the left ventricle pushes it up through the aorta, and then it goes out to the body. Cycle starts all over again. Okay? Easy peasy. Come on, ladies, gentlemen. This is not difficult, and this is how a heart works. Whether it's a chicken heart, a pig heart, a frog heart, whatever it is, this is how it works. Some have less chambers. Some don't have 4 chambers, but most animals and a big part of the reptilians have 4-chambered hearts. So good stuff to remember. All right, so we talk about the pipes. The pipes are the veins in the arteries. Okay, the arteries carry blood away from the heart. Then the capillaries form a network. Here you go. This is where that gas exchange happens. It distributes blood to all parts of the body. The veins return the blood from the capillaries back to the heart to be reoxygenated. And then finally, the fluid. So you have to have the pump, the pipes, and the fluid. The fluid is blood, obviously. The liquid part of the blood is what we call plasma. Red blood cells carry oxygen and carbon dioxide. The white blood cells, they consume bacteria. You can see these little guys. See the white blood cells? Man, they're big. Okay? And then these are little red blood cells. Blood cells carry oxygen. Okay? Plasma is the water that's in between. Okay? All right. Then the platelets. Platelets, let's get rid of me real quick so you can see it. I don't like for you not to have it. Okay. All right, there we go. Platelets form clots that help to stop bleeding. Okay, that's what these guys are. They're the little specks. Okay, and then remember those red blood cells, how important they are. And then the white blood cells, like we said, they consume bacteria and viruses to combat infections in the body. All right, so pulse. A pulse is a pressure wave that's generated by the pumping action of the heart. In a conscious patient, you can easily find the radial, remember? Here's that thumb again. All right, radial pulse is on the side of the thumb, you know, just below the thumb right here. Everybody feel your own radial pulse real quick. Just take it. I'll see, turn my hand. You see that? Yeah, right there. Feel it. I want everybody to feel it. There you go. All right, so in a conscious patient, you'll be able to find this as long as their blood pressure is greater than 90 systolically. If a patient appears to be in shock or is unconscious, attempt to locate the carotid pulse right here on the side of the neck. Everybody feel your own carotid. All right, so if they appear to be shocked or unconscious, go ahead and locate it there first. All right, shock is defined as failure of the circulatory system. Circulatory failure has a lot of causes. Remember, we're going back to the anatomy again of circulation, pump, pipes, fluids. So the heart may fail, or the pipes may be doing something. They may be constricted, they may be dilated, or they may be, cut open where they're bleeding, either inside or outside, okay? And then ultimately, because of that, you can have fluid loss. Have fluid loss from internal bleeding or external bleeding. There's also another fluid loss that don't forget about. That's dehydration, okay? Water, you gotta have water to live. So here's your little drop of water. Whoop. Okay, you gotta have water. If you don't have water, you're gonna have less fluid in your body. The plasma is the water, and that can cause dehydration, which can also lead to shock and circulatory failure. All right, so pump failure, cardiogenic shock occurs if the heart cannot pump enough blood through the supply of the needs of the body. So pump failure, the pump has a heart attack or is damaged. Okay, so then the pump doesn't pump effectively. This is like your pool pump or your irrigation pump or your fuel pump on your car. When they go bad, they don't pump well enough. Okay, so they're not getting enough movement of gasoline or water or your heart blood, okay, throughout the body. So that inadequate pumping of the heart can cause blood to back up. It backs up in the vessels of the lungs, because remember, the blood comes from the lungs. The oxygenated blood comes from the lungs. It comes into the left atria, if you remember that, okay, and then it goes through the pulmonary valve. Right? Everybody remember that? We were just talking about that. So when you have a failure of that pump, and it's not bringing it through the heart and out to the body, it'll back up into the lungs, and that results in what we call congestive heart failure, or CHF. Pipe failure. Pipe failure is caused by the expansion of the capillaries as much as 3 or 4 times the normal size. So what happens is when they expand, blood pools in those capillary beds, okay? And then the rest of the body is not getting blood. So when all this dilation happens, expansion is dilation, okay? When it pulls down there in the capillary beds, and we had billions of capillary beds, blood pressure falls and shock results. This is caused by massive vasodilation. All right, so shock-inducing fainting is one of those forms. It's psychogenic shock. Fainting is a short-term condition. Normally corrects itself once the patient is placed in a supine or horizontal position. Lay them down. Lay them down, and they generally recover very quickly. Anaphylactic shock. Okay, this is caused by an extreme allergic reaction to something, some kind of foreign substance. The patient appears to be flushed, breathing may become difficult, and blood pressure drops rapidly because of the rapid amount of vasodilation. The veins, okay, there we go. The veins, when they're being in position of normality, they're about this, they're nice and round and they're a specific size. Vasodilation is when they suddenly get bigger, okay? And when they get bigger, everything just, blood pressure drops. Because it's the constriction of those vessels that creates pressure. What ultimately can happen is death will result if prompt action is not taken to correct anaphylactic shock. And then finally, another pipe failure is spinal shock or neurogenic shock. This may occur in patients who have sustained a spinal cord injury. If the injury, what happens is that our spine and our brain are in conjunction with one another. The brain is going through the spine, it's giving chemical receptors, and it's giving neurological signals to all of the blood vessels. And it's saying, squeeze, everybody. And then every now and then you can dilate a little bit, or you squeeze, dilate a little bit. And so what happens is that when you cut that area, the vessels go to a normal state. A vessel is normally dilated if it's not told to do anything else. It expands and dilates. So as soon as you have an injury in the cord, it's not being told to constrict anymore to maintain blood pressure, so it dilates. Okay, so that injury allows the capillaries to expand and blood pools below the level of the injury. The brain, heart, lungs, and other vital organs are now deprived of blood that results in shock. Okay, so that's spinal shock. Fluid loss. Fluid loss is caused by excessive bleeding or hemorrhage is the most common cause of shock. Blood escapes from your wound, and then the system's total fluid level drops. The heart becomes pump faster, like we talked earlier, to maintain the pressure in the pipes. And then the pumps eventually stops pumping, which results in cardiac arrest if the bleeding is not stopped. External bleeding is easy to detect. I mean, you see it, going all over the place. With internal bleeding, it can't be seen. But we can get some signs and symptoms from the outside of the body if you'll undress the patient and start taking a look, like bruising, swelling. If the area that you think that the trauma has been occurred at, and especially in the abdomen, okay, even in the legs and that kind of stuff, it'll swell and it'll be very hard and rigid. And then there'll be severe pain in that immediate area as well. Whether the bleeding is external or internal, if it remains unchecked, it's going to result in shock and pump failure, and then ultimately death. So you got to keep after it. Find out what the cause is. If you can stop the external bleeding, stop it. Internal bleeding, just recognize it and get them transported promptly. All right, so fluid loss. And an average adult patient has about 12 pints or 5.7 liters. 5.7 liters of blood in the circulatory system. The loss of 2 or more pints can lead to shock. Now, this particular diagram shows you how much blood you can lose in specific areas. Basically, what you're looking here is pints. Okay, here's all your pints. So upper extremity, you can lose a pint, or we'll talk liters, 12 pints. Sorry, these are liters. So you can lose, usually a half a liter to a liter in upper extremity, 3 liters in the chest, 3 liters in the abdomen, 3 liters in the pelvis, 2 liters in any thigh, a liter from a leg, or even a liter from an ankle or the foot. So loss of 2 or more pints can lead to shock, okay? So not good, not good, not good. So this is in consideration of what could happen. You lose, 3 liters, you're going to go into shock. That's more than half of your blood. So we got to remember that. You can lose a lot of fluid in these areas, especially in the trunk areas. All right, so shock deprives the body of sufficient blood and function normally. As shock progresses, the body alters functions in an attempt to maintain sufficient blood supply. So signs and symptoms of shock are confusion, agitation, restlessness, anxiety, cold, clammy, sweaty, pale skin. Signs and symptoms of shock continued, all of this can happen, okay? Rapid breathing, rapid weak pulse, capillary refill time. If you remember back from the assessment, capillary refill time can be very simply squeeze an extremity, a finger, okay? And what you do is you're pushing all the blood and then let go and watch the blood return. Go back to a pink, and it should be less than 2 seconds. Nausea, vomiting, weakness, or fainting, or even thirst. All right, so how do we do it? How do we general treatment for shock? Patient, present the patient correctly. To combine shock or to combat shock from any cause and keep it from getting worse, you need to do some very simple steps. Position them correctly. If the patient has no head injury, extreme discomfort, or difficulty breathing, lay the patient flat on their back in a horizontal surface. Place a blanket underneath the patient. Okay, elevate the patient's leg according to local protocol, or legs. If the patient has a head injury, spine injury, or lower extremity injury, do not elevate the legs. If the patient is having chest pain or difficulty breathing and no spinal injury is suspected, place the patient in a sitting or semi-reclining position. Maintain your ABCs, treat the cause of shock if possible. Maintain the patient's body temperature, very, very important. Don't allow a patient to eat or drink because that may cause vomiting and then present yourself with some airway problems. Patients in shock may need surgery and should not have anything in their stomachs. Right, assist with other treatments. If you train in administration of oxygen, give that to your shocky patient. Advanced emergency medical technicians or paramedics can give administration of intravenous IV fluids, which will help to a point. Then arrange for transport as quickly as possible. All right, so treatment of shock based by pump failure. So the pump has failed. Okay, something is wrong with the heart. Pump failure is a very serious condition. Your proper and treatment and prompt transport by an ambulance is really their best chance, whether it's a heart attack, whether it's a cardiac contusion from an automobile crash, whether chest hit the steering wheel kind of thing. They need to get to a hospital right away. So there's not a whole lot you can do about that. All right, so pipe failure, such as, the dilation. We're going to talk about that. Anaphylaxis shock. You need to treat them promptly as early as possible. They need to be transported to a hospital. Paramedics, nurses, and physicians can administer medications that can reverse the allergic reaction. Some patients who have severe allergies may carry that epi-auto injector. Remember that EpiPen we were talking about? An environmental. Support the patient's thigh, again, and place the tip of the auto injector lightly against the outer thigh. Using a quick motion, push in the auto injector firmly against the thigh and hold it in place for 10 seconds, at least 10 seconds. Could save somebody's life just by something simple. Right, shock caused by internal blood loss. There's not a whole lot we can do about this, obviously, to support them because these are stomach ulcers, ruptured blood vessels, tumors, those kind of things, some kind of internal bleed. They need to be in surgery. They need to be in a hospital as soon as possible. So you may see signs and symptoms like coughing up blood, abdominal tenderness, a rigid abdomen, bruising, distension of the abdomen. They could even be complaining of rectal bleeding. Then women could also be complaining of vaginal bleeding as well. These things need to be at the hospital as quickly as possible. All right, so recognizing the 3 types of external bleeding. This is a capillary bleed here. Very simple, okay. This particular one would be, this particular injury here would be a venous type of bleed. You know, it's kind of oozing out here, not a big deal. And if you could see this, this is a hockey player that his carotid artery was cut by a stick. They really didn't notice it until right away, but if you look right here closely, you see the blood spewing out of his carotid artery. And that's what's on the ground. This is blood here, but you can see it just pouring out right here, okay, all the way up. And then there's blood on the floor over here. He did survive this, but it was an accident. You know, obviously he got checked in the close to the face area, and it hit his carotid artery and ruptured it, cut it well enough where it sliced the carotid artery, and he lost a lot of blood, but they got control of it and got him to a hospital very rapidly. All right, so we talked about capillary bleeding. It's the most common, you know, external blood loss. It's a very small cut. It just oozes out. Direct pressure to the site is fine. Venous bleeding is the second most common type. It has a steady flow and direct pressure for at least 5 minutes should resolve that problem. Arterial bleeding is the most serious type. Arterial blood spurts or surges with each heartbeat. Direct pressure and maintain pressure until EMS arrives is how we control that. All right, so there's examples of direct pressure. You know, it talks about dry sterile dressing, wrap the dressing in wound. Don't pull off the dressing once the bleeding has been, you know, managed. Just leave it. Put more dressings on top if you need to. Elevation, if direct pressure does not stop the external bleeding from an extremity, elevate the injury. So you can see here she's lifting the arm up above the level of the heart as well as applying direct pressure. Tourniquets. They're indicated only in situations in which the extremity bleeding cannot be controlled by direct pressure. You'll be trained in this application of a tourniquet in Skill Drill 14-1 on your lab skill day. Pressure points. In cases where a wound is too close to the trunk to apply a tourniquet, you can prevent blood from flowing into the limb by compressing the artery against the bone. The brachial artery pressure point and the femoral artery pressure point are the most important areas to utilize for this. Here's your brachial artery point, okay, and here's your femoral artery point. It may take a lot of pressure to stop the bleeding that's below those sites. All right, so standard infection control and bleeding control. Make sure to wear nitrile gloves whenever you might come in contact with patients' blood or bodily fluids. Remember, we got to wear gloves, folks. This is part of our standard precautions. If you do get blood on your hands, wash it off as soon as possible with soap and water. This does not mean you've been exposed. If your skin is intact, you're okay, but you need to wash very quickly as soon as you can. If you can't wash, use a waterless hand cleaning solution that contains an effective germ-killing agent. Wounds. A wound is an injury caused by any physical means that leads to the damage of a body part. Wounds are classified by either opened or closed wounds. Closed wounds, the skin remains intact. The only closed wound, the only closed wound is the bruise. It shows an injury of the soft tissue beneath the skin. Small blood vessels are broken on the underneath skin and it becomes discolored and swells. A simple bruise heals quickly and usually is not very complicated at all. Bruising and swelling may be a sign of an underlying fracture, though. You got to remember that. So in your assessment, if the patient is complaining of pain or you feel the bones are not intact underneath by the feeling of crepitus, which is bones rubbing together, then there's probably a fracture there. Open wounds. An open wound results in a break in the skin. A simple one is an abrasion. It's also called a scrape or road rash or a burn, that kind of thing. This occurs when the skin is rubbed across a rough surface. Here's an example. Okay, and here's a cutaway on the level of skin, the different layers of skin. As you can see, it only involves the epidermis. And then you have punctures. Okay, this occurs when a soft, sharp object penetrates the skin. It may cause a deep injury. You may not be able to recognize what's completely involved in that injury until the patient, obviously has gotten into surgery. Puncture wounds don't necessarily bleed freely. Okay. Like, for instance, an impaled object, if it sticks out of the skin, is still putting pressure on the vessels, and so it's really not leaking. But a gunshot wound is a special type of puncture wound. Right, so here's a puncture wound, an impaled type of object. As you see, it's gone through the superficial. This particular diagram shows superficial and through the dermis. This just looks like it's through superficial or the first layer. It may have some second layer involved in it. But this is a type of impaled object because obviously it's a nail. You're not going to pull this out. There's no reason to. Transport them to the hospital and let the physician resolve this kind of issue. Laceration. Laceration is the most common type, often called a cut. Everybody calls lacerations a cut. Minor lacerations may require very little care. Large lacerations can be a lot more involved. You can have a lot of extensive bleeding and can even be life-threatening. There's a laceration here. This looks like venous bleeding like we were talking about in the other diagram, and usually it's both the epidermis and the dermis layer. Okay, so epidermis and dermis layer. Avulsion amputation. Avulsion is a tearing away of body tissues. If the entire body part is torn away, the wound is called a traumatic amputation. Amputated parts should be located as quickly as possible and then placed in a clean plastic bag and keep that particular amputated part cool and then taken to the hospital because they might be able to reattach it. So it needs to go to the hospital with the patient. All right, so here's an open wound, a pretty significant one. This is the knee, okay? This is the tibia or the shin bone, and then the femur is here. So this is an open wound. It's a considerable amount of tissue that's been exposed. This is muscle tissue here. It looks like it's kind of dirty, that kind of stuff, but this is an example of an open wound. Right, so principles of wound treatment. Very minor bruises need no treatment. You can put some ice on, that kind of thing. Instruct the patient to elevate, that kind of thing. Rest, ice. You can put constriction on a part if you want, and elevation. So other closed wounds should be treated by applying ice and gentle compression. Okay, that's the compression, and then elevating the injured part. Splint all major contusions. If there's a big bruise or something, just go ahead and splint it in case there's a fracture underneath. Stop bleeding as quickly as possible using the cleanest dressing available. All right, so dressings, they're applied to control bleeding, prevent further contamination, and also to immobilize that injured area, and then sometimes utilized to prevent the movement of objects. Dressing is an object placed over a wound to control bleeding. Once it's in place, apply firm, direct manual pressure on top of it to stop any bleeding. At least hold it for 5 minutes. These are different sizes. The three most common is 4x4, 5x9s, and 10x30s. They're all different sizes of gauze dressings, especially the 10x30. They're like a padded kind of gauze dressing. They're used for large wounds. Here's some examples. Here's your 10x9. Here's your 6x, and here's another 6. This is a 6x6. This is a 4x6. It looks like this is a 4x4, and then this is an eye patch here. Okay, so they come in different sizes, for you to utilize. Be very familiar with what you have in your first responder kit. And know what to use on different types of injuries. You'll get to practice this in your skill labs. Right, so bandaging, it's something, the bandage is used to hold the dressing in place. Roller gauzes, this is what this is. This is roller gauze, and these are your triangular bandages. I really like triangular bandages. I use a combination of roller gauzes and triangular bandages to manage, to properly manage wounds by bandaging them appropriately where they're not going to come off. That's the whole point, is that they don't come off until they're ready to be taken off, once they get into the hospital. Principles: ensure that the dressing completely covers the wound, extends beyond all sides of the wounds. Wrap the bandage just tightly enough to control the bleed, but not so tight that it cuts the circulation. You need to check that circulation regularly. Secure the bandage so that it cannot move off. Okay, can't fall off of the patient. You don't want that to happen. Standard precautions. Remember, guys, you got to wear gloves. You should be wearing something to protect your eyes, all that kind of stuff. And this needs to be readily available in your life support kit, and then or a pouch on your belt or in your BDU pockets. BDUs is battle dress. Okay, battle dress units. Those are your pants, so battle dress uniform, that's what BDU stands for. So make sure that you got plenty of gloves and your safety glasses. Very, very important stuff. Right, so face and scalp wounds, usually relatively small laceration of the face that can actually, cause a large amount of bleeding. The scalp and the face is very brisk and filled with lots of capillaries and arteries. So you can control them, though, relatively easy with some direct pressure. There's an example, got direct pressure, got a head bandage on. Now, one of the things I want to let you notice about this, and we'll teach you this in lab, this kind of dressing will come off if you don't put a hat type of dressing on using a triangular bandage. And we'll show you how to do all this. You need to have a bandage, some kind of holding mechanism on the bandages that you're using, so to keep it in place. Otherwise, it's just going to come off. Right, so face and scalp wounds. For wounds inside the cheek, hold a gauze pad inside the mouth. Keep the airway open. Try to stop the bleeding. Scalp lacerations can be associated with skull fractures and brain injuries, so you need to be very, very much so aware of that. If brain tissue or bone fragments are visible, don't apply any pressure on it. And then cover that wound loosely. Head injuries in the neck and spine may also be injured, so move the head as little as possible and stabilize the neck, monitor the patient's airway, breathing, and protect their spine. Nosebleeds, they can result from injury, high pressure, dry air, that kind of stuff. Nosebleed with no apparent cause is called spontaneous nosebleed. Management, usually the patient is experiencing some shock, so have the patient sit down and tilt the head slightly forward, okay? There you go. Pinch both nostrils together for at least 5 minutes. If the nosebleed persists or is very severe, arrange for transport. Eye injury, when an eye is lacerated or suspected, cover the entire eye with a dry gauze pad. Have the patient lie on his or her back and arrange for transport or whatever is comfortable. Whatever is comfortable for the patient. If a small foreign object is lying on the surface of the eye, use a saline solution to flush the object from the eye. Right, so impaled object. Immediately place the patient on his or her back and cover the injured eye with a dressing in a paper cup so that the impaled object cannot move. Then bandage both eyes and arrange for transport. The reason why we're bandaging both eyes is because when one eye moves, the other eye moves. So if you have both eyes bandaged, they will tend to keep them still so that there won't be any additional damage. All right, so neck wounds, direct pressure to control the bleed. Once the bleed is controlled, put a good dressing on the neck. And what we use is a dressing that will not allow it to, a dressing over the wound that won't allow air to come back in. So this is a sealed type of dressing. This is actually a tegaderm type of dressing. So it's adherent and it doesn't allow for any air to go back into the vessel. In rare cases, you may have to exert finger pressure above or below the site. Major traumas of the neck may be associated with airway problems, so maintain the patient's airway and consider stabilizing the head and neck. All right, so chest and back wounds. Major organs are affected by chest wounds and back wounds. They're the lungs, the large blood vessels, and the heart. Any wound involving these organs is a life-threatening injury. So place the patient with a chest injury in a comfortable position. If a lung is punctured, air can escape through the lung and it will collapse. Patient may also cough up bright red blood in this circumstance. So help maintain air pressure in the lung by covering the open chest wound. If there's an open chest wound, cover it with an airtight material. Such a covering is called an occlusive dressing. At first, just put your hand on it, your gloved hand on it, put it on there to seal it, and then use a clear plastic cover, aluminum foil, plastic wrap, gloves, or a special dressing that has been impregnated with petroleum jelly. Administer oxygen if it's available and you're trained to use it. Again, they may damage the heart. Seal the wound. Monitor ABCs, treat the patient for shock, and perform CPR if necessary. If the patient breathing becomes more labored after you seal the wound, Just remove the seal briefly and allow excess air to escape and then reseal it. So if you have a hole, these are typical for gunshot wounds. Gunshot wounds or stab wounds or any kind of penetrating wound to the chest, air is leaking. So you seal it. If they start getting short of breath, okay, unseal it, let the air escape, and then reseal it, okay? That'll help the patient out immensely until EMS gets there. All right, so impaled objects, anything that's stuck into the abdomen, to the chest, whatever, you need to stabilize it with a dressing and then arrange for immediate transport. Sometimes an impaled object is too long to permit the patient to be transported. So stabilize the impaled object and carefully cut it close to the patient's body. Make sure that EMS arrives before you start doing stuff like this, because they have a lot more experience than you do. Make sure that they get there and you guys do it as a collaborative effort. All right, so here you go. If an object is protruding from the abdomen, don't remove it, but support the object so it cannot move. Place gauze towels on either side of the object and secure them along with additional gloves. Lots of bulky dressings. All right, so closed abdominal wounds is a direct result from blunt trauma or a direct blow to the abdomen. Look for other bruises or marks on the abdomen. Whenever the patient experiences shock, there may be internal abdominal injuries. Place these patients on their backs and elevate their legs if indicated by local protocol. Use blankets to conserve their body heat and treat for shock. If the patient's vomiting blood, it may be indication the bleeding is from the esophagus or the stomach. So make sure you monitor the airway and their vital signs and give the patient nothing by mouth. And make sure you get them transported right away. Open abdominal wounds, they result usually from a slashing with a knife or another sharp object. And in these cases, the intestines may be protruding through the skin. So place the patient on their back, okay, with the knees slightly bent so it keeps from pulling down on the abdominal muscles and opening that wound. Slightly bent, okay, whatever's comfortable. Put a pillow up under their knees and make sure to keep them from laying their legs flat as much as possible. Covered that injured area and looking at the organs hanging out with a sterile dressing, okay? Moist sterile dressing. Moisten it, okay? Because we don't want it to stick and dry out the organs, the intestines. Don't attempt to replace the intestines back inside the abdomen in any way, shape, or form. Just do the best you can to manage them until help arrives so y'all can collaboratively, help one another and get this proper dressing on. So this is a good example. Here you got the legs bent. This is your, your organs hanging out of the knife wound. The legs are slightly bent. You put on your moist sterile dressing. Put on another cover dressing on top of that moist sterile dressing, and then using your ACE wraps, you could tie that around there and keep it in place. All right, so genital wounds. Male and female genitals are very, very rich in blood supply. So injuries to these areas can result in severe bleeding. Best thing we can do is apply direct pressure with a dry sterile dressing. Although it may be embarrassing to examine the patient's genital area, you need to do so if you see lots of blood in the groin area of their clothing, that kind of thing. You've got to take a look and see if there's bleeding there and do the best you can to stop it. Extremity wounds, apply dry sterile compression dressing and a bandage securely in place. Elevate the injured part to decrease the bleeding and the swelling, and then splint all injured extremities prior to transport because there may be an underlying fracture. Now, if the patient is critical, we're not going to splint on scene. We'll splint on the way. Okay, don't let any of these efforts, any extremity effort, delay transport. No way. They need to get to the hospital. If they're going into shock, the number one thing is to get them to surgery, at least get them to the ER where they can start replacing blood. You replace blood with blood. So get them going as soon as you can. Okay, here's a good dressing. Okay, you got a dressing external, and then they wrapped it with a compression dressing utilizing a ACE wrap, ACE bandage here, triangular bandage, not ACE bandage, triangular bandage. And then over here, they're simply wrapping it with roller gauze. And you'll get a chance to practice all these in your labs. Gunshot wounds. Most deaths from gunshot wounds result from the internal blood loss. Gunshot wounds to the trunk and neck are the major cause of spinal cord injuries. So treatment is open the airway and establish adequate ventilation and circulation. Control any external bleeding, manage the patient's airway thoroughly, locate all entrance and exit wounds, treat for shock, and arrange for prompt transport, and then perform CPR if the patient's heart stops. Bites, all bites carry a risk of infection, especially human bites. So patients should seek treatment for all bites. It doesn't matter. Also, know your local protocol if this is a reportable type of incident. Minor bites can be washed with soap and water. With major bite wounds, control the bleeding and apply a dressing and a bandage. Burns, the skin, serves as a barrier. It's one of the largest organs called the interogamatory system. Okay, that is your skin. It also prevents the loss of body fluids. When the skin is damaged, it can no longer perform these essential functions. Burns is a part of it. Okay, this is a first-degree burn. Right, redness and painful of the skin. The injury is confined to the outermost layers of the skin. The patients experience, moderate pain. It's nothing that's intolerable, but usually it's just a simple first-degree burn. As you can see by here, this young lady has been out in the sun for too long. She's definitely got first-degree burn. All right, so partial thickness burns are second degree. Do not damage the deepest layers of the skin, but it causes blistering, as you can see here. These are very clearly, you can see blisters, okay? It also causes fluid loss and moderate to severe pain, and usually heal in about, anywhere between 2 to 3 weeks. But this is a significant burn. It's painful, okay? It's painful. All right, so these are full thickness burns. As you can see, this person has very, very severe burns. The skin is very leathery, and as you can see here, the skin actually split open like a hot dog here. That's because it's full thickness. It's damage to all layers of the skin. Pain is absent because the nerve endings have been destroyed. Patients lose large quantity of fluid, and they're very highly susceptible to infection and death. So the extent of the burns, we use what's called the rule of 9. That is the method to determine what percentage of the body has been burned. For an adult, the head and the arms are equal 9% of the body surface area, and the front and back of the trunk of each leg are equal to 18%. This formulation is slightly modified for kids. All right, folks, let's talk about this real quick. All right, so as you can see, the head is 9, extremities 9. Okay, so this is the front. So half of his arm is only 4.5. Everybody understand that? If it's just the burn is isolated to this area, it's only 4.5. Does everybody understand that? That's very important to remember because many times you got to divide this in half too. Its division is about right here. So if it's just the upper chest, it's only 9%. All right, same thing down here. If it's only the upper thigh, it's only 9%. All right, and the same as you can apply the same kind of methodology to the infant and the child. All right, it's very important to estimate these properly, and because it definitely makes a difference whether they go to a trauma center and what kind of fluid therapy is going to be done. So, and it's pretty impressive to the medic if you can get there and give them an accurate representation as a first responder on what the total percentage of body burns are. All right, so cause or type of burns. Thermal burns are caused by heat. Place the burn area, place the burn area in a clean and cold water. You need to stop the burning process, period. Cover it with a dry sterile dressing or a burn sheet after it's been cooled. You can just continue to cool it as long as you don't introduce hypothermia. Don't ever break any blisters that you may see. Patients with large burns must be treated for shock and transported to a burn center. Respiratory burns, these are very dangerous. Okay, a burn to any part of the airway. Usually you see singed hair, around the mouth, or soot in the nose or in the mouth. There are burns around the face, singed nose hairs again. They usually show signs of difficulty breathing or pain while they're breathing, and they may become, unconscious because they're not getting enough oxygen. Breathing problems can develop very rapidly or slowly. So administer oxygen if you're allowed and trained for it, and prepare to perform CPR and arrange for prompt transport. Chemical burns. Many strong substances can cause chemical burns. Many can do that. Chemical burns, the longer the chemical remains in contact with the skin, the more damage it does. This is your initial treatments. Remove as much as the chemical as possible. Remember we talked about dry chemicals? Brush it away first before you do irrigation. Flush with water for at least 10 minutes. I know before in the other diagram it said 20 minutes, but I tell you, the solution to pollution is dilution. All right, lots of water. Get it off of them, because the longer that stuff is on the skin at concentrated levels, the more it's going to burn. All right, continue on with chemical burns. Chemical burns to the eyes, bad stuff. Flush the eyes with water for at least 20 minutes. All right, so we're much more longer. I mean, you might do your initial flush and the rest of the flushes are going to be on the way to the hospital. I am not going to sit on scene with somebody flushing their eyes for 20 minutes. They need to go to the hospital. So don't delay transport. Do the flushing on the way to the hospital. Hold the eye open to allow water to flow over the entire surface. Loosely cover the injured eyes with gauze bandages and arrange for prompt transport. Electrical burns, we talked about this with lightning. Occur when electrical current enters the body, but it's not always lightning. People get burned from, especially on the workplace where they're working on electricity. Electricity causes a lot of internal damage and changes to tissues. Patients may experience irregularities of their cardiac rhythm or their heart rhythm and may go into cardiac arrest. So we need to use our defibrillator and CPR training, right away. Be certain the patient is not still in contact with electrical power. Scene safety, number one. When you approach the patient, call from assistance from the power company or from somebody that can disconnect the power. And then obviously you're going to monitor the ABCs of electrical burn patients and arrange for transport. Alrighty. Multi-system trauma. This is bad. Okay, multi-system trauma is an injury that affects more than one body system. Okay, as a first responder, you're not expected to diagnose the patient's injuries, but several body systems may be injured in situations that involve significant trauma. As you assess patients, be alert for signs and symptoms of injury to each part of the body. We want to be able to find these right away. Go ahead and take the clothing off the patient of multi-system trauma. These are patients that are ejected, from cars or motorcycle accidents. Anything that's a severe form of trauma can involve multi-system trauma that has a high impact or a high mechanism of injury. All right, so in summary, you need to use standard precautions. Prevent contact with the patient's body fluids. Remember, PPEs, gloves, safety goggles, that kind of stuff. We also talked about the three parts of the circulatory system. The pump, which is the heart. The pipes, which are the arteries and the veins and the capillaries. And then finally, the fluid, and all the blood cells. Remember we talked about red blood cells that carry oxygen, white blood cells that fight bacteria and viruses. Okay, we talked about the platelets that are involved in the clotting process, and finally the plasma, which is the water that makes up the blood. Three primary causes of shock are pump failure, pipe failure, and fluid loss. Three types of external blood loss are possible, or capillary, where the blood oozes out. Venous, it bleeds at a steady flow. And then arterial, where the blood spurts and surges. Most external bleeding can be controlled by applying direct pressure. Direct pressure is the first thing, that slows it down, then you can go from there. A wound is an injury caused by a physical means that lead to damage of a body part. Wounds are classified as either closed or open. Open wounds are classified as abrasions, punctures, lacerations, and avulsions or amputations. We also talked about controlled bleeding, direct pressure, elevating extremity, and then applying a tourniquet when using pressure points. Tourniquets are great. Stop the bleed programs have proven that tourniquets save lives. So think about it. You can't stop a bleed, or you don't know where that bleeding's coming from an extremity, put a tourniquet on it. Three classes of burns are distinguished based on depth, superficial, partial thickness, and full thickness. And then burns can be caused by heat, chemicals, or electricity. All right, folks, don't forget, it's time for your assessment. Go back to your dashboard, do your assessment block for this chapter, and then submit it. And don't forget, take it a bunch of times. Get up in the 100% range, man. Do it. You can do it. I have confidence in you, okay? And if you have any questions, you know how to get in touch with us. Email us at student@emets.net. All right, folks, have a good one. We'll talk to you later.